Do you have any history of hypertension or hypotension or any cardiac related health issues?
No.
Good.
99. Two. Cannot see those. 1, 2. Cannot see that.
Okay, all right. I'll go ahead and take that from you. So there's definitely a deficit significantly on that left side there. Okay, all right.
No, I do hear something. Yes. Yes.
Hello.
Hi.
Hi, Maggie.
Hi.
How are you feeling today?
Pretty good.
Good. Thank you for coming into the clinic. It's very nice to meet you.
Nice to
My
meet
name
you
is
too.
Dr. Perez. I have you in as a first-time patient today.
Mm-hmm.
Okay, all right. Well, I've got your chart pulled up here. I'm just going to go ahead and get that situated, and then we can begin with your examination. So, my name is Dr. Perez. Welcome to the clinic. I understand that it's your first time here today.
Mm-hmm.
Okay, so do we have you in, for anything specific? Are you in just for like a general once-over?
Just a general checkup.
Okay, a general checkup. Very good. It's always good to keep up with your annual appointments. All right, so let's see. I didn't see anything specific noted by the medical assistant when she did your intake. Aside from just like a general head to toe examination, did you have anything specific you wanted me to pay attention to today?
No, not really. Just a general overview would be great.
Feeling pretty well overall?
Yeah.
Okay. That's very good news. So I do have just a few basic questions to get started, if that's okay.
Mm-hmm.
All right. If there's anything you don't want to answer, you are welcome to decline. Everything is pretty standard, though. So general assessment. So as a whole, are you feeling pretty well today? Are you in any pain? Is there anything that's making you uncomfortable?
No.
Good. So would you say your pain is like a 1 out of 10?
Yeah.
Okay. Good. Any recent injuries, falls?
No.
No. Good. And have you had any recent surgeries, something like in the last 24 months? No. Good. All right. And when was your last annual physical exam?
About this time last year,
Okay,
I'd say.
so you're pretty up to date, not
Yeah.
too far behind. And was there anything specific that was found during that examination, or was everything okay?
Nope, everything was pretty good.
Good. So overall, you would say you're in pretty good health.
Yeah.
All right. And then just a couple questions about your like day-to-day activities. Do you typically exercise daily, on a daily basis, every other day?
I do.
Okay.
Every other day about.
Every other day. And what is your primary method of physical activity?
I get about 10K steps in per
Okay.
day.
Pretty active cardiovascularly. Are those passive steps, or are you doing like active cardio at the gym, or just kind of walking around?
Yeah, I do some slanted, what is that?
Like incline walking?
Incline walking,
Okay.
yes.
Okay.
Incline walking.
All right. Incline walking is very good for you. It's also good for the lower body. So. All right. Let's see. And then as far as your job, do you have a job that's pretty physically demanding, or is it more sedentary?
I work from home and
Okay.
it's computer based.
Okay, so
Sedentary.
very sedentary.
Mhm.
Do you work at a desk, a standing desk, a seated desk?
I
Seated
try
desk,
to work
excuse me.
a standing desk
Standing
as much
desk?
as possible.
Definitely beneficial, especially for work from home
Yeah.
jobs.
I also have a walking pad, so
Okay,
I try to get more
lovely.
steps in that way.
Do you find that you use it pretty regularly?
I do.
Okay, good. So that's good. There's only so much you can do when you work from home and your job is mostly sedentary, so it
Yeah.
sounds like you're doing as much as you can to remain active there, so that's very good. Now with that, I'm assuming there's heavy computer use or use of electronics. Do you find that you ever have any straining of like your neck or any headaches or blurry vision, anything related to overuse of electronics?
I do sometimes have soreness in my shoulders.
Is that both shoulders?
Yes.
Okay, all right. So obviously that's fairly common. Unfortunately, when we're looking down at a screen, we tend to, have our neck leaned in a way that's kind of unnatural. So with the standing desk, it's a little bit easier to ensure that the screen is at eye level. That would be preferable. And then just try to square your shoulders off, tight at the core. Those are things that you can do to try to alleviate that a little bit.
Thank you.
Do you ever find that discomfort is so bad that you have to take something over the counter? Is it ever that uncomfortable, or is it usually okay?
No.
Okay, good. All right. Do you have about an average how many hours a day you're looking at a screen, whether it be computer or your phone?
Probably 5 or 6.
Okay. All right. So that is a little bit on the high side. The only thing I would recommend maybe is if you can just to give your eyes a rest every hour or so, try to take a 5 or 10 minute break and then look at something that's not, not on a screen, look across the room, walk around, something like that.
Good tip. Thank you.
Of course. All right, Maggie. So just a quick question about any symptoms you may be having. I know you said you're feeling pretty well. Anything in the head, ears, eyes, nose, throat area?
I am feeling a little blocked in one of my ears, actually.
Is it the right ear?
Yes, my right ear.
Okay, and by blocked, do you mean like water in your ear, earwax in your ear?
I think it might be a little wax in my ear.
Wax? Okay. Have you had a history of protruding earwax, excess earwax?
I did. Actually, at my last exam, I did have to have a bit removed.
Did you? Okay,
Forgot to
from
mention that
from the
earlier.
same ear?
Yes.
Okay, all right. And did they remove the wax manually, or did they use a suction device?
A suction device.
Okay. So,
with water they use.
okay, so there probably was quite a bit in there then. All right. So I will have a look at that. And you feel like it's bothering you now?
Yeah, I used some drops and it got a little bit better, but it's
Okay.
still, I can hear less.
Do you have any cerumen or earwax or fluid that's coming out of the ear canal?
I do not.
Okay. And then do you use Q-tips at home?
I don't.
No. Okay, so that's very good. We definitely want to avoid that, especially if you have an increased production of wax. So I will have a look inside your ear. Do you feel like it's affecting your hearing at all?
A little bit.
A little bit? Okay. So we can do a hearing test and see if anything there is affected. So how long would you say, I mean, last year obviously you had a removal, but in the recent time frame, how long would you say you've been feeling that you've had more wax than normal?
Literally just this morning I woke up with a blockage.
All right. Good timing then. Maybe we can
Yes.
have a look there. By chance, are you a swimmer? Do you spend a lot of time in water?
I
You
don't.
don't? Okay. All right. So it's probably not really.
I do use headphones quite a bit though. I was told
Is that
that.
over the head headphones or
Yes.
in ear?
Both.
Okay. Okay. Both. Okay. So that can, especially if you're listening to things a little bit too loud, your eardrum tends to produce more wax in an effort to protect your hearing.
Okay.
So that can be part of it. It is interesting that it's specific to the one side. So I'll have a look and see if it looks like there's any damage to the eardrum itself. Otherwise, it could be both over the head and in-ear earbuds, unfortunately, can cause damage to the ears. So
Okay.
just something to pay attention to. Are you using them to listen to loud music or just...
Music sometimes. Also YouTube videos
Okay.
sometimes.
Okay. So just daily use as well.
Yeah, daily use.
So just try to be cognizant if you can of the level that you're listening to, but I will go ahead and have a look at your ear there. Okay, so you said the right side. Is there any pain followed down on the jaw area with that, or it's just the ear? Okay, all right, good. And then moving down, anything with the upper body, shoulders, clavicle, upper extremity limbs, nothing
Just
like
that
that?
soreness we mentioned
Soreness
sometimes.
at the shoulder. And then is that on both sides?
Nope, just towards the back here.
Okay, got it. Upper traps, I will have a look there. Anything that radiates down the spine, lower back?
No.
Nope. Any abdominal discomfort?
No.
Okay. And then lower extremities are all okay? Hips, knees, ankles?
Okay.
Good. And then as far as your diet, any specific diet that you follow, whether vegan, vegetarian, low carb?
Pescatarian.
Pescatarian? Okay. And is that just preference or for health reasons?
Both.
Okay. And do you find that that suits you pretty well? You don't have any sort of abdominal discomfort or anything there?
Nope.
Good. Fish is very good for you, so I have no complaints there. You're obviously providing enough nutrients and hopefully getting in enough protein. Do you find that you drink an adequate amount of water throughout the day?
I try to.
Okay. Okay. So it's the thought that counts, I guess. At least you're trying. And then would you say you drink caffeine throughout the day, whether it be coffee, tea?
Nope.
No caffeine.
Just water.
Just water. Okay. All right. All right. Well, I think that is all I have for you here. Let me just see. All right. So your vital signs were obtained by the medical assistant. Everything there looks fine. So there was no indication of hypertension or anything like that. Your heart rate was fine. Your blood pressure was well within normal limits. I will go ahead and perform a stethoscope assessment to listen to your cardiac health as well as your lungs, but otherwise everything there was fine. So temperature and everything was normal. So why don't we go ahead and get started? I'll just set this aside for a second. All right, Maggie, so we are going to go ahead and get started with an initial visual assessment. So this is something I like to perform with every patient. I'm just going to have a look and see if there's anything I'm noting externally that could be potentially abnormal. So I'll have a look with my Penlight. You don't have to look at it. You're welcome to just look across the room, or you can close your eyes, whatever is more comfortable for you.
Okay, thanks.
So I'm going to start just by kind of having a look here, looking at the face and the cranium. I like to check for symmetry of the facial features. And looking for any signs of asymmetry at the shoulder. The scapular indentation looks good from what I can see. All right. So very good posture. Your natural posture is well aligned. You're sitting upright, strong at the core, which is a good sign. Elbows are midline with the abdomen. And knees symmetrical, no signs of wasting at the lower extremity. Good. All right. Skin looks good. Overall complexion is very even throughout. I'm just gonna touch here at the chin. You are fairly fair skin. I do see just a few freckles. Do you typically wear sunscreen on a daily basis?
I do.
Good. Okay. Is it okay if I move your hair just slightly, have a peek at the forehead?
Mm-hmm.
Okay, I do see one larger mole here. It's not raised above the surface of the skin, and it is fairly round, so I might have just a closer look at that, but that looks okay. Right, no signs of edema at the thyroid. I don't notice any swelling of the throat. Is it okay if I just have a look at the palm of your hands?
Sure.
No signs of palmar erythema. Nice and clear. Small. Is that a scar or a freckle?
A freckle.
Freckle. Okay. Another one there. And then I'm just going to look at the nail beds. Hands are very well groomed. Nail beds are healthy. All right, that looks okay. You can go ahead and relax. So, initial external inspection, everything looks okay. I don't see anything that looks particularly concerning there, so that's a good sign to start with. All right, so why don't we go ahead and begin with our stethoscope inspection. I like to get this out of the way pretty early. So, all right, Maggie, so I am going to listen to your heart. Now, do you have any history of hypertension or hypotension or any cardiac-related health issues?
No.
Good. Okay. So I'm going to listen just around the carotid artery to start with, and then just kind of around the clavicular area. So I want you to just breathe normally for me. I'm just going to move your hair here. It is a little cold. I apologize. So, initial perfusion as well. Within normal limits. I'm not hearing any signs of occlusion here on the left side. Good. I'm just going to listen here at the front. Okay. I'm just going ahead and move your shirt very slightly. I want to listen just below the clavicle here. So I'm going to place this right underneath your collarbone. Good. Not hearing any arrhythmia there. I'm going to come over on the other side. In here on the right side. Good, nice and strong on this side as well, so you are fairly symmetrical bilaterally. Just going to listen right over medially at the throat. Can you just swallow for me gently there, Maggie? Good. Okay. And then again, I'm going to listen just below the collarbone here. Right. Okay. Then if I can have you sit tall for me, I'm going to see if I can hear the abdomen through your sweater. I should be able to hear for any abnormal bowel sounds. Did you have breakfast this morning?
I did.
Okay. Hear a little bit of digestion. That's a good sign. Now you breathe in and hold your breath for me. Good. Go ahead and slowly release. Very good. Okay, that sounds good. All right. So I'm going to come around the back and listen to your lungs. Okay? All right, Maggie, I'm just behind you here. I don't want to startle you. I am just going to touch you with my stethoscope. Have a brief listen to your lungs. So I'm going to start here just at the back of the neck. Listen here, right next to the scapular indentation. Apologize for any ambulance sounds. We are fairly close to the emergency department on this side of the hospital. So as I come down, I'm going to have you breathe in deeply at the diaphragm for me. So take a big belly breath and hold it in. Go ahead and release. Good. We're going to do that one more time on this side. So big breath in for me. And go ahead and release. Very good. Lungs are very clear, so no sounds of anything suspicious there. That sounds great. While I'm back here, I'm just going to do some very brief percussion. So you're going to feel a tapping, just like this. When I tap, I'd like you to say 99 out loud, okay?
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
And I want you to breathe in for me, and then just exhale as normal. Perfect. Very good. Very good. All right, I'm going to come back around the front. All right, Maggie, all of that looks and sounds good. So, don't have any concerns about your cardiac or your pulmonary health at this time. All of that sounded fine.
Awesome.
So we can go ahead and move on to the secondary part of your examination now. Why don't we go ahead and perform our ocular assessment. So I'm just going to clean this off.
I do have contacts in at the moment.
Do you? Okay.
Mm-hmm.
Do you wear glasses as well, or typically
do.
just lenses?
Mm-hmm.
All right. Do you know by chance if you're near or farsighted?
Which one is which?
Far-sighted is when you can't see up close. It's kind of the opposite. So nearsighted is when you have trouble seeing far away.
Nearsighted.
Okay, all right. I'm also nearsighted, so I sympathize with you there. So I'm just going to have a look at your eyes. You can let me know if the light is too intense or if it's uncomfortable. You do have fairly light colored eyes, so it could be slightly uncomfortable, but just let me know. So you don't have to look directly at it just yet. I'm going to have you look at a point just across the room.
Okay.
So at this point, just testing for your pupillary constriction and dilation. So I'm just going to shine this in your eyes. I'm just going to come a little bit closer to you here. So you do have a very healthy reaction, both consecutive and independent reaction is intact. I'm just going to cover one side here and then cover the other side. Good, and then I'll let you blink it out for just a second. All right. So I'm going to have you follow the light now. Okay. So I'd like you to keep your head kind of fixed at a midpoint. Try not to move side to side if you can, and you're just going to trace the light with your eyes. Okay. So we'll start here. Good. Good. Very good. Look up. And down to the right. And I'm going to have you just follow it around in a pattern here. Any blurry vision or double vision here?
Nope.
Any floaters of the vision or little stars?
No.
And as I come further away, can you still see the light here?
I can.
So I want you to follow it all the way in as much as you can. Good. Did that cause any discomfort behind the eyes?
No.
Okay. Okay. You did really well there. So I'm just going to switch my tip. This device is called an ophthalmoscope. It's going to allow me to look directly in your eye. So I will be able to have a look at your optic disc and any nerves that you have and see if there's any signs of inflammation or redness or just anything that looks particularly abnormal. Fair warning, I do need to come kind of close to your face in order to be able to see appropriately. Okay. So on this side, I'm going to have you just look kind of off to the side for me. Just focus on a point across the room. You don't have to look directly in the light. Probably preferable that you don't. It is fairly bright. I'm just going to come closer to your eye. And starting in the outer corner, I'm going to work my way in. I do see your lenses. They look clear and well fitted to your ocular anatomy. And coming in closer. Optic disc is visualized. I'm going to very gently pull down at the eyelid and have a look at the sclera. And if I could have you look down for me, Maggie. Good. Very good. All right. I'm going to come on the other side. We're going to repeat the same exact thing. So I'm going to start here at the outer corner and following that in. Go ahead and look down for me. And just briefly look up. Good. Okay. All right. All right. All of that looks good. Optic disc was visualized. There's no redness or anything, just normal veins. That's totally fine. All right. Just going to clean this off. I will do some further testing with your eyes. Just want to go ahead and use this while I have it out. So I'm just going to, excuse me, just switch this here. I'm just going to have a look inside your ears as well as your nose and throat. And you said you haven't been sick in the recent weeks. Any issues with your nose or throat? Any issues with nasal patency or like blockages of your nostrils?
Nope.
Good. Do you have seasonal allergies ever?
I do not.
You don't? Okay, good. So I'm going to start by having a look in your ear. Now you said the right ear is the one with excess wax.
Yes.
Okay. So I'm actually going to start on the left so we
Okay.
can kind of get an idea of what it looks like on a normal basis. So I'm going to move your hair. Lovely earrings. It's very pretty. So I'm going to have you turn your head kind of down into the side, and then I'm going to pull your ear just back there, and you're going to feel the otoscope enter your ear canal. It shouldn't cause you any discomfort. And on the left side, I do see a normal amount of cerumen, nothing that looks concerning. Color is normal, texture is thick, but nothing that I would say is abnormal, and your tympanic membrane is clear, no signs of occlusion there, so that looks good. And if I palpate here at the pinna, that feels okay?
Yep.
And no pain here down below?
No.
Good. Same thing, we'll just have a look on this side. So I'm going to have you just turn your head down and tilt. Very good. Okay, so I do actually see the blockage that you were talking about, and it is quite severe. Your earwax is very thick. I actually can't visualize the tympanic membrane here. Okay. Is there any pain here?
No pain.
No pain. And here?
Nope.
Okay, so it's not causing you any discomfort?
No.
Okay. I will say, so if we kind of have a look here and visualize that this is the ear canal, I can't see the tympanic membrane. It is completely blocked off with earwax.
Oh, wow.
Okay, so it is pretty severe. It's a solid wall of wax that I see on that side, versus on the other side it's completely clear. So.
Okay.
Okay.
Strange.
Okay, so we might need you to see an ENT. Do you have like a resident otolaryngologist that you visit?
I don't.
You don't? Okay. I have someone that we work with in the clinic that I can refer you to. So it does look like you're going to need another removal. It is kind of impacted there. Okay.
Thank you.
Of course. All right. So let me just pause for a second here. I'm going to document that before I forget. All right, Maggie. So just notating here. It's the right ear. So I am going to go ahead and get you referred over to our ENT because I do think we don't want to wait anymore. It is pretty blocked off there. And you said you are or are not having trouble hearing? Are you not quite sure?
A little trouble hearing on
Okay,
the
so
side.
does it sound muffled?
Yes.
Okay, so I definitely will do a bit more of an extensive hearing test, and then I'll still send the referral, obviously, for the removal. So I have that documented here. So we can proceed with the remainder of your examination. So why don't we circle back to your eyes? I just want to do a quick follow-up test there. So I'm going to test your peripheral vision. So just have a little applicator sponge here. Now, can you tell me what color that is?
Green.
Good. So I'm going to move it in and out of your visual field. I'd like you to just indicate when you see it and when you no longer see it. So for example, if I hold it obviously here in front of your face, you should be able to see it with both eyes. If I then move it and have you keep your gaze fixated at a point here, tell me when you can no longer see it.
I can't see it.
Good. And as I bring it back in, can you see it? Good. So we're going to repeat that at different points of your visual field.
Okay.
So I'll start on this side. I'm going to have you keep your head fixated just straight across the room there. So can you see this here?
Yes.
Good. And tell me when it disappears.
Disappeared.
And reappears.
Reappears.
Good. Again.
Disappears.
Good.
Reappears. Disappears. Reappears.
Very good. And here.
Disappears. Reappears.
Good.
Disappears. Reappears. Disappears. Reappears.
Very good. Okay, so that is all good. I'm going to test very similar. This time I'm going to hold up my hands. I'm actually going to use a visual occluder for this. So Essentially, this is just going to block one of your eyes. So if I can ask you to hold this up, you can choose which side you'd like to start with.
Okay.
So we're actually going to hold it just like this.
Oh.
Perfect. There you go. And then I'm going to hold up my hand. I'm going to flash some fingers. I'd like you to attempt to tell me how many fingers you see.
Okay.
So here, I just want you to tell me, can you see my hand?
Yes.
Okay. And how many fingers am I holding up?
2.
Good. And here?
4.
Good. And here?
1.
And here?
2.
And here?
3.
Very good. Some of this will be slightly more difficult. Can you see here?
1.
Good. And here?
4.
Very good. And then I'll do one more.
3.
Good job. Okay, so we'll have you switch eyes there.
Okay.
All right, so
Am
we're
I
going
supposed to be staring at one place, or can I?
It's not going to allow you to look past a certain point, so
Okay.
really it's okay either way. I have it pulled away far enough to where you should or should not be able to see it appropriately. So
Okay, great.
can you see my hand here?
Yes.
And how many fingers here?
2.
And here?
I can't see that.
Okay. Here?
2.
Here?
3.
Okay, so we did get a couple wrong there. We'll try here.
Can't see over there.
Okay, and here?
2.
Here?
2. Nope, can't see over there. Can't see up there.
Okay, and here?
2.
All right. Do you typically have trouble seeing out of your left eye?
I don't.
Okay, so let's retest that.
Okay.
There were quite a few actually that you missed on that side. So why don't we, let's see. Try again with a colored tip on my finger. It might be just a little easier for you to visualize here. So why don't we start with orange. I'm just going to set these here. Okay, so we are going to try just with your hand. So I'm going to have you cover your eye with your hand. And I want you to try to remain at a fixed gaze here if you can, and then tell me when you see the orange.
Okay.
So,
Now. Now. Now.
I'm going to come from top here.
Now.
Good. So then let's switch eyes, because this is the one you had difficulty with. So same thing, just try to remain at a fixed point here.
Okay. Now. 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 Now.
Okay, that was a little bit better. I'm going to have you keep your eye covered. Can you tell me how many fingers I'm holding up here?
Nope.
Can you see my hand here?
I can see your hand.
Okay. And here?
3.
And here?
2.
Good.
3.
Okay.
4.
Can you see my hand here though?
I can see your
Okay.
hand.
I'm going to have you switch eyes for me. Let's just repeat that on
Okay.
this side just so I can make sure that it's not an anomaly, but I do think there's a bit of a deficit there. So again, just remain at a fixed point here. Can you see my hand here?
I can.
How many fingers am I
2.
holding? Good.
3.
Good.
2. 4. I can't. I'm gonna say 2.
Okay, so we were very close there.
2.
Okay, you can go ahead and relax, Maggie. So I'm going to say that you do have a bit of a deficit with your peripheral vision. Okay,
okay.
so much more severe on the left side.
Mm-hmm.
All right. Very interesting. Is that something you've been told before by a previous provider or by your optometrist? No. When you have your regular optometrist appointments, do they test your peripheral
They
field?
don't usually.
Okay. All right. So it could be something to request the next time you go in. Do you typically do annual appointments?
That's a good question. Yes, but just for contact lenses. to see
Okay,
if it's required
okay.
any.
All right. So sometimes at the optometrist office, they don't do as extensive as an examination, excuse me, if you're not experiencing anything, any grave symptoms, they might not test for that.
Mm-hmm.
If you were to see an ophthalmologist, however, obviously they would do a much more in-depth examination. So I'm going to test again. I have the same occluder. This time I'm going to occlude both sides. Now,
Okay.
there are kind of some divots here where you should be able to see something, so I just want to see how well you do with this. So I'm going to have you
Okay.
hold this up again. All right, so I'm going to hold up, let's see. I'm going to hold up objects here. These are identical objects. Can you see these?
Yes.
Can you see that I'm holding two?
Yes.
Okay. So I'm going to flash either one or both. I just want you to tell me if you see one or two.
Okay. 1. 1. 2. 1. 2. 1. Oh, 2. 1. 2.
Okay. So I'll have you go ahead and switch eyes for me. Can you see these here?
Yes.
Can you see that there are two?
Yes.
Perfect.
2. Cannot see those. 1. 2. Cannot see that.
Okay. All right. I'll go ahead and take that from you. So there's definitely a deficit significantly on that left side there.
Mm.
Okay. All right. Okay. So I might actually want to refer you to both an ophthalmologist and a neurologist. So ophthalmology obviously will have a more in-depth look into your eyes. Now I did, visualize your optic disc via my ophthalmoscope. I can only see so much, though. They have special machines that they can go in and take like a retinal scan and that kind of thing. So I do think that would be beneficial for you. And then as far as the neurologist, let me put in a neuro consult. That will just ensure that there's nothing going on with your brain that could be causing a deficit in your vision.
Okay.
They'll test for things like color blindness, different kinds of color deficiency tools that I don't have in office here. So if that's something that you're open to, I do think both of those referrals would be, well, actually 3 referrals now with the ENT. So that's good. And now that you're new to the clinic and you're coming in for your initial assessment, it's helpful that we go ahead and get everything looked at. So
Thank you.
I'm just going to put that in for you here. And all of those are fairly local to our office, so you shouldn't have to travel very far. All right. All right, Maggie, are you doing okay so far?
Yep.
Do you have any questions for me at this point?
No, I think I'm good.
Okay, all right. Let's go ahead and proceed with the examination. Why don't we do, let's see. I think I'm actually going to circle back to your nose and throat, and then we will perform a hearing test. All right, so I am going to come here and just have a look at the nair. Now, I'm going to have you tilt your head back just slightly for me. I'm going to touch your nose just at the tip here and then have a look inside the nostril. Nice and clear. Don't see any pinkening there. And no signs of swelling or anything, so that's good. I'm just going to hold here. I want you to just take a normal breath in for me. No signs of occlusion there. And on this side. Slightly stronger there, but nothing I would say is concerning. I'm going to occlude both sides. I want you to breathe in through your mouth. Very good. Then if I can just have you open at the mouth for me, I'm just going to have a peek at the back of your throat. Good. If you can just stick your tongue out and say, ah. Very good. You can let the skin line back of your throat is clear. I could have you smile for me, Maggie, with your teeth. Good. All right. No signs of asymmetry at the smile there. That's very good. So let's go ahead and perform a hearing test. I am curious to see how much we will have a difference from one side to the other given that blockage there. So I'm going to test with this as well as this. And we will start with what I would say is the most easiest, the most distinct sound. Okay, so I have, let's see, I have a tuning fork here. I'm going to produce a sound. I'm going to start with your eyes open. I will ask you to close your eyes at some point. So
Okay.
can you hear that? just from here? And do you hear that on both sides?
Yes.
Okay, good. So now I'm going to ask you to close your eyes for me. Do you hear this equally on both sides?
Yes.
Can you hear that here?
Yes.
Good. Can you tell me if this one is louder or two?
2.
Very good. You hear this here?
Yes.
Tell me when the sound stops.
Stops.
Very good. You hear this at the center?
Yes.
And now?
Yes.
So same thing on the other side. Can you hear this here?
I can.
So do that one more time. I apologize. I'm going to move
That's
your
okay.
hair actually. All right. And that there you can hear?
I can hear that.
So if this is one or 2 louder?
2.
And again, I want you to tell me, can you hear that?
Yes.
Tell me when it stops.
No.
Good. Okay. All right. Now, you hear this at the center?
Yes.
And now,
Yes.
and now.
Mm-hmm.
Very good. Okay. All right. So we are going to test with a secondary object here. So I have just a pair of tweezers. I'm just going to make a sound with them. It's not very loud, but you should be able to just hear it here.
Okay.
Okay. So first I'm going to do the same thing. I'll ask you to close your eyes. I want you to just say yes when you hear something, and then we'll perform a different exam.
Okay. Eyes closed.
Yes. Can you hear this here?
Yes. 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 No, I do hear something. Yes. Yes. Yes.
Good job. All right, Maggie. So I am going to now test directional hearing. So I'm going to move it from one side to the other, and I want you to tell me where you hear it. So you're going to say left to right or from left to right, front, back.
Okay. Right to left. Left to right. Left. 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 Right.
I'm going to test one more thing for your hearing. So I'm going to do a whisper test. So essentially I'm going to occlude one ear, and then I'm going to say a few words or a few numbers on the other side, and I'd like you to attempt to repeat the words for me. Okay?
Sure.
It's going to be a series of 3. I'm going to ask that you close your eyes. Just going to gently include this side. Planter.
Planter.
Thermometer.
Thermometer.
Table.
Table.
Good. And I'm going to do 3 numbers. 7,
7.
17,
17.
77.
77.
So do the same on the other side. I'm just going to clean this side.
Table.
Lamp.
Lamp.
Shoulder.
Shoulder.
16.
16.
66.
66.
62.
62.
Okay. So with the audible examination, you did okay. There were some deficits, however, when we did the tool test. So again, obviously we will go ahead and just add that in your note for the referral to the ENT. Because there are some deficits with your hearing as well. Not quite as severe as I would expect, honestly, considering that it is pretty well cut off there. So
Okay, that's good.
okay, so let's go ahead and move on to a test of your reflexes. So I have a reflex hammer here. I'm going to test first at the facial reflexes. So I want you to just kind of relax the musculature here, just try to relax, and then we're going to hang your jaw just very loosely open. Any pain with any of that?
No.
I'm going to ask you to perform a couple movements for me while I'm up at the head. If you can turn your head all the way to the left. Any pain there?
No.
And all the way to the right. Any pain there?
No.
And then if we can extend all the way back. And then all the way forward, chin to your chest. Any discomfort with any of that?
No.
So I'm going to test some reflexes in your arms.
Okay.
I'd like you to just kind of let your elbow bend and then just rest the weight of your arm in my hand. Good. Same thing here at the wrist. You're just going to roll your sleeve up just a tiny bit, if that's okay.
Mm-hmm.
Good. And then I'm going to test at the middle finger here, just checking for rigidity of the joint. Same thing on this side. Just rest the weight of your arm here. Very good. Your upper extremity reflexes are doing really well. So I'm going to do kind of a tracing of your hand. I want you to keep your eyes open and just look forward for me. So
Okay.
just testing for a neurological response here. So. And then we'll do the same thing on the other side. Very good. Go ahead and relax. Alright, now so I'm going to test at the lower extremity as well. So you've probably had this done before. Check the reflexes at the knee. It is just a little bit uncomfortable, so I apologize. I want you to just kind of relax your legs.
Okay.
And you're going to feel very strong. Good. Good. And then I'm going to test your Babinski reflex. So I'm going to drag this across your foot. It does tickle just a little bit, okay?
Okay.
So I'm going to lift your leg and I want you to just completely go flaccid at the ankle. You do have socks on, so. Okay, and then we'll do the other side. Okay, you can go ahead and relax. Slightly diminished response there, but I did see a little bit of flex. That's okay. All right, Miss Maggie. So the last thing I'm going to test for your examination today is going to be for your sense of touch.
Okay.
Now I'm going to test that with our temperature assessment, and then I will do a sharp versus a dull.
Okay.
This is a very easy examination. Essentially just going to ask you if you can feel something. Now, these are similar in temperature, but I think you should be able
One will
to
be
tell the
colder
difference.
than the
So,
other. Okay.
can you feel, obviously that's cold.
Yes.
Do you feel that that's colder?
Not really.
Not really. Okay. So let's use the colder one.
Okay.
And then I will use my hand as a secondary.
Okay.
So you should be able to feel that is very cold, and
Yes.
then my fingers are slightly
Yes.
warm. Okay.
Mm-hmm.
So I'm just going to move your hair here slightly. I want you
Okay.
to just close your eyes for me, and then, of course, just indicate which one you feel.
Okay. Cold. Warm. Cold. Warm. Cold. Both. Cold. 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 Both. Cold. Warm.
Good. And I'm going to test for your sharp or dull response now. So I'm going to show you on your hand because I don't want it to startle you. This one is obviously very soft.
Yeah.
This one is pretty distinctly sharp. It's not going to hurt, but it is fairly sharp. So
Yes.
I won't use it around your eyes, but you will feel it around your face, and I want you to just indicate whether or not you feel the sharp or the dull.
Okay.
So to start with, I just want to make sure here. Can you feel that that's
Yes.
dull or
the-
soft?
Soft.
And this here is very sharp.
Sharp. Mm-hmm. Soft. sharp, soft, soft, sharp, soft, sharp, sharp, both.
Okay.
Soft,
Okay.
sharp, sharp, soft, sharp, both.
Okay. You can open your eyes. You did really well. There were no deficits there. All of that was
Excellent.
well within normal limits. So that was
Great.
very good. Okay. All right. So that is going to conclude your annual assessment. I'm just going to document that your sensory exam was well within normal limits. There was nothing concerning there. Do you yet have access to our patient portal? Did you go ahead and sign up already, or have you not done that?
I don't
yet?
think I've signed up yet.
So you can either do that on your own time or on your way out. You can head to the receptionist desk and they can help you fill it out. It's good to have if you'd like access to things electronically. I tend to send over referrals that way. If you'd prefer a phone call or email, that works as well.
Okay.
Okay. So I would like you to go ahead and set that up just to have it, and then I will put all of these referrals in and see if maybe we can try to get those done within the next few weeks.
Awesome. Thank you.
Did you have any questions for me before you go?
No, I think I'm good.
Okay.
Thank you.
All right, Maggie, I'm going to go ahead and input all of this, and I hope you have a wonderful day.
You too. Thank you.